I see a lot of people asking questions about the autism assessment process and what to expect at their appointment. So in this video, I'm hoping to explain a little bit more about what that might look like. The process can be quite different depending what county you're in or what service you're using, but hopefully this will give you a broad idea of what to expect. The first thing that's really important to say when looking at autism assessments is that they must be NICE guidelines compliant. So NICE stands for the National Institute of Health and Care Excellence, and they're the body that sets out the standards that must be met for an assessment process to be valid. If you're using NHS services, they will be compliant. Their services have been built around these guidelines. Similarly, right to choose will be NICE compliant. So, right to choose is when an independent company has applied to be a right to choose provider to the NHS and they have proven that they meet these guidelines, and then the NHS will fund the assessment process through them. So, lastly, it's if you've gone privately, this is definitely a question you want to ask, and you want to make sure that they are NICE compliant for any diagnosis you get to be valid within the wider healthcare system. The first part of the assessment process is information gathering. So this will always include parents and carers, and it could be done in a variety of different ways and maybe a mixture. So it might be a conversation that you've had in an appointment, or it might be through questionnaires that are sent to you to complete. It might be done at your actual assessment at the start. So it can look very different. If your child's attending an education setting, we will also be looking to get information from them. So this might be your nursery, preschool, or primary school. Again, that's often done through questionnaires. Don't worry if what you're saying and what the education setting is saying doesn't perfectly match. This is really common. Children can present differently in different contexts. So we are very used to seeing that. So please don't worry. What can also be helpful is to maybe take a couple of videos of your child at home playing or interacting with you, so we can see what is normal within the home setting. It can also help you explain what you're trying to say. A couple of videos is great, so maybe how they are typically, and then maybe if there's any behaviours you're a little bit more concerned about, that can be really useful. Apart from that, you shouldn't really need to bring anything to your assessment. If you do need to, you'll be told this before. It might be some extra forms you need to bring, but that should be about it. The next part of the assessment process is direct appointments with the professionals who will be completing your assessment. So one of the guidelines that has to be met is that there is multiple professionals in agreement on the diagnosis. So not a single professional can decide if a child has autism or not. So it has to be a multidisciplinary team assessment. But that can look quite different depending on who your child's already had appointment with, who they're known to. So if your child's already working with a speech and language therapist because of a language delay or communication difficulties, and they're now being referred to the paediatrician for an autism assessment, it might be that the paediatrician reaches out to the speech therapist and asks for some information from them. And then that box is ticked if they're in agreement. If your child hasn't been known to professionals already or hasn't been seen for a long time, the assessment might look a little bit different. That might be through what we call a multidisciplinary team assessment. So that might be where they come for between 1 and 3 appointments with a range of professionals who all complete their observations and assessments at the same time. So regardless of which type of assessment you're having, they can look very similar in terms of what we do. And it can look like we're not really doing a lot. Often it's just through play and observation. So what we're looking at is what your child is choosing to play with, how they play with it, and how they interact with the people in the room. Don't worry if in the assessment your child isn't presenting how they do normally. This is why we've done the information gathering before, and we might even ask you, is this typical? How's it different? So we kind of picking up on that information. We appreciate it's an unusual situation for your child to be in, meeting new people and maybe a different room than they're used to and things. So we factor all of that in, so please don't panic. The final part of your assessment process is the feedback. So most commonly this is going to involve another appointment face to face or by video with just you and without your child. And this is where the professionals or one of the professionals involved in the assessment will talk you through the findings, what evidence there was to support a diagnosis, what evidence that doesn't support it, and then if a diagnosis is being made, and what the next steps are. Receiving a diagnosis and not receiving a diagnosis can be equally tricky for parents depending on what you feel to be true for your child and you know them best. If you're struggling with the idea of the diagnosis, or similarly, if you believe a diagnosis hasn't been given and it should have, there are support systems in place for both of those things. So you can attend post-diagnostic workshops where you might be able to learn a little bit more about the diagnosis your child has been given and what that means and why it's been given. And if your child hasn't been given a diagnosis, it's not the end of the road. It's not being given at this point, and they might have suggested watchful waiting, they might have suggested reassessment at a later date, or you might need to kind of push for that at a later stage if you still feeling that that's what applies best to your child.
Thank you very much for watching. I hope you have found this video useful, and best of luck with your assessment.